This is the first session that describes the sympathetic nervous system. The learning objectives are to explain the effect of sympathetic nervous system on the body and to describe the clinical application of today's session. The sympathetic nerves originate from the lateral horn cell of all the thoracic and the upper three lumbar segment of the spinal cord. It's called thoracolumbar system. The preganglionic sympathetic fibers leave the spinal cord with the ventral root of the corresponding spinal nerves. Then, they pass via the white rami communicants into the ganglia of the paravertebral sympathetic chain. Then, the course of the fiber can be one of the following three ways. It can pass with the postganglionic neurons in the ganglion that it enters. It can pass upward or downward in the chain and synapse in one of the other ganglia in the chain. Or it can pass for variable distance through the chain and then through one of the nerves radiating outward from the chain to synapse with the neurons in the collateral ganglia. The postganglionic fibers then travel to their destination in the various organs. Remember that the sympathetic division of the autonomic nervous system is responsible for preparing the body to face the fight, fright, and emergency condition. Starting with the sympathetic nervous system supply to the head and neck, which is the cervical division. This division supplies various structure in the region of the head and neck. It arises from the lateral horn cell of the upper two thoracic segment of the spinal cord. Preganglionic fibers reach the sympathetic chain and proceed upward and relay in the superior cervical ganglion. The postganglionic neurons that arise from this ganglion pass along the branches of the carotid arteries and supply the following structure: the eye, the salivary gland, the lacrimal gland, the skin of the head and neck, and the cerebral blood vessels. We'll discuss the effect of sympathetic nervous system on the head and neck, starting with the eye. In the eye, sympathetic stimulation causes mydriasis, which is dilatation of the pupil. Sympathetic stimulation to the eye produces widening of the palpebral fissure due to contraction of the levator palpebris superioris muscle, thus increase the field of vision. Sympathetic stimulation to the eye produces vasoconstriction of the blood vessels of the eye. Sympathetic stimulation of the eye produces exophthalmos, which is protrusion of the eyeball caused by contraction of the molar muscles behind the eyeball. This is seen in animals. Sympathetic stimulation to the lacrimal gland of the eye produces vasoconstriction of the blood vessel and trophic secretion, that's to say, no tears. The effect of sympathetic stimulation on the skin of the head and neck. Sympathetic stimulation produces vasoconstriction. The sympathetic stimulation has a secretory effect on the sweat gland, thus increasing the sweat secretion. Sympathetic stimulation produces contraction of piloerector muscle, thus leading to erection of the hair. The effect of sympathetic stimulation on the salivary glands. In these glands, sympathetic stimulation causes vasoconstriction, contraction of the myoepithelial cells that surround the salivary acini, leading to salivary secretion characterized by being little, viscous, concentrated secretion. That's to say, it's a trophic secretion. The effect of sympathetic stimulation on the cerebral blood vessels. Sympathetic stimulation produces mild vasoconstriction accompanied by increased cerebral blood flow due to the increase in the systemic arterial blood pressure. Now, the sympathetic nervous system supply to the thoracic viscera, which is the cardiopulmonary division. This division supplies the heart and lungs. It arises from the lateral horn cell of the upper four thoracic segment of the spinal cord. The preganglionic neurons that originate from these segments reach the sympathetic chain, where they relay in the lower cervical and upper four thoracic ganglia, from which postganglionic neuron arises and supply the following structure: the heart, the coronary blood vessel, and the bronchioles. Now we'll describe the effect of sympathetic nervous system on the thoracic viscera, starting with the heart. Sympathetic stimulation to the heart increase all cardiac properties, excitability, rhythmicity, conductivity, and contractility. Thus, increase the rate and force of contraction of the heart and increase in the excitability and rate of conduction. Sympathetic stimulation to the heart produce vasodilatation of the coronary blood vessel. This is done by indirect mechanism. This is secondary to the increased cardiac activity, increased oxygen consumption, and increase in the carbon dioxide and hydrogen ion level. So sympathetic stimulation to the heart is manifested on the patient as increase in the heart rate and increase in the arterial blood pressure. The effect of sympathetic stimulation on the lung. Sympathetic stimulation inhibits the secretion of the mucus from the bronchial gland, produces bronchodilation due to the relaxation of the bronchial muscle. Sympathetic stimulation produces vasoconstriction of the bronchial blood vessels. What could be the clinical application of today's session? Horner syndrome is a clinical application of this session. It's due to a lesion in one side of the cervical sympathetic chain. It results in the following effect on the same side of the lesion, that's to say the ipsilateral side. Ptosis, which is dropping of the upper eyelid. Miosis, which is constriction of the pupil. Anhidrosis, absence of sweat. Vasodilatation, due to the absence of the sympathetic vasoconstrictor effect. So the skin will be warm and more red in comparison to the healthy side. Enophthalmos may be seen in animal. Bronchial asthma is another clinical application of this session. From this session, we know that the sympathetic stimulation inhibits the secretion of the mucus from the bronchial gland, produces bronchodilation and vasoconstriction of the pulmonary blood vessels. So, in bronchial asthma, where there is bronchial narrowing, patients are treated with sympathomimetic drugs to decrease the mucus secretion and produce bronchodilation. By this, we finish today's session. I hope you enjoyed it. Thank you.